Hi, my name is Amanda Yamrogevitz, the General Manager of the Cardiometabolic Health Congress. Back in Boston for the first time in 4 years. Very excited to be back in Boston where the Cardiometabolic Health Congress started back in 2006. This year's meeting's theme is the present and future of cardiometabolic health. We kicked off on Wednesday with pre-conference sessions on cardiometabolic health and the elderly patient, which is a very important and trending topic in cardiometabolic health. We've got diabetes management, obesity, lifestyle, nutrition, cardiovascular disease. We have NASH this year, and we also have renal hypertension, and the list goes on in the cardiometabolic spectrum.
It's great to be here today at the annual CMHC 17th annual meeting. I'm going to be talking today on new therapies for treatment of hyperlipidemia, and this is really an exciting time to be in the cardiometabolic space because there's so many new therapies that we can offer our patients, from lipid-lowering therapies to therapies for diabetes and weight management. And it's just the right size where we get to network with our peers, we get to have some really interactive and dynamic conversations at this conference.
And this is such a great location, especially in fall. I have to say I got my morning run in. We're right by the public park, the public gardens. It's a beautiful place to go explore Boston. And we have great lectures all focused on cardiometabolic health topics that are relevant from multidisciplinary clinicians. I enjoy the exhibit hall. They have a meet the experts after each session so that the audience can get more one-on-one time to our expert speakers and meet us in the exhibit hall right after our talks.
One of the great things about the Cardiometabolic Congress is the chance to see new data on not only in the sessions but the posters. I think the most posters we've ever had at one of the meetings this year. All kinds of great information. We have wonderful people presenting, and it's just a great opportunity also to have the face-to-face discussions with them.
This is my favorite conference. I started in 2013, came to everyone through 2019, and I was desperate for it to return.
As an internist, my job is to change a variable to improve outcomes. I found cardiologists were treating LDL, endocrinologists were treating sugar, and nobody was treating risk reduction. And then I finally met Bob Echo with the Cardiometabolic Conference, and I come here, and I'm now learning to bridge that gap. I'm doing the cardiology reduction, I'm doing the diabetes management, I'm doing obesity and nutritional management, I'm doing hepatic steatosis, chronic kidney disease, and it's great to come here, talk to the specialists. They're very accessible, and I love asking them questions, picking their brains, and that's really why I'm here.
So I'm very new to this, especially as a college student, and at times it can be a little overwhelming as clearly the youngest person in the room at usually all times, and everyone here has been incredibly welcoming and friendly, and I've talked to so many people at the top of their fields in all the realms of healthcare, and that's been just an incredible experience that I don't think I could really get anywhere else. So I've been eternally grateful to have the chance to come here.
And this meeting, for the first time, I am noticing high intense level discussions getting into the physiology and the biochemistry and the pathology of it all at the cellular level, and getting deeper into that multi-system disease concept. I think one of the most amazing meetings where we now are realizing that the heart and the kidney and the liver and the pancreas and the brain, with the presentation on the neurohormones and dopamine level, as you saw, they're also interconnected. And this interconnectedness is what we've always been talking about, that there are relationships.
This is my first visit. I really liked it. It's a high energy. It's great to meet all the experts in the field. It's nice to feel that there are a lot of people who think in this way, of an evolving specialty. We have a lot of metabolic issues with our patients that are managed by different professionals. And it's great to know that there is a field and one can be empowered to use all the arsenals of medications that they are available.
So the Cardiometabolic Health Congress has been growing over the years. We not only are doing our annual meeting, we have our CMHC spring meeting. Next year, it's going to be a focus on inflammation and cardiometabolic health. Taming the Flames. We are going to be having another Women's Cardiometabolic Health Masterclass in August of 2023. So we're going to be back in Southern California for that. And then we're back in Boston for the next few years for our annual Cardiometabolic Health Congress. It's such a wonderful city, especially in the fall with the colors changing. And so Boston will be next year, October 2023. And then finally, we launched our Foundations of Cardiometabolic Health certificate course earlier this year. It is 50 plus hours of education, 9 different modules chaired by Dr. Robert Eckel. It's going to be constantly updated, different resources and information added, and that is a huge part of bridging that gap between postgraduate education and formal cardiometabolic health training to just change the patient care model and advance education in cardiometabolic health. If you need any more information on our live events, our certificate course, we have a lot of complimentary CME activities as well as videos. We're going to be putting all of our live events on demand. Any other information you need can be found at cardiometabolichealth.org.